Okay, I'm Dr. Fahad Riaz. I'm working as a postdoctoral fellow at EPID at Work Research Institute in Lakehead University. Okay, so currently I'm leading this project. It looks into the lived experiences of people who are working in male-dominated industries in northwestern Ontario. So basically this study is about identifying their protective and risk factors for mental health. The pilot project, what we aim for longer term is a longitudinal qualitative study by focusing on all 20 industries in northwestern Ontario, but currently we are focusing only on male-dominated industries, namely something like construction, manufacturing, transportation, mining, and agriculture, forestry, and fishing. So we are halfway through the data collections. It's not completed yet, and we haven't started analyzing the data yet, but from my experience, like my RA and myself, we have conducted a couple of interviews. So what we are hearing from the participants, there are some interesting findings. Mostly they're talking about stress at workplace due to harsh environment, something like the environment where a lot of physical force is required or physical energy is required. And especially one of the important findings I want to talk about is something that comes from our women participants. So because they're working in this male dominated industries, so they have reported that they need to build that thick skin to endure subtle and overt sexism or gender based discrimination. So that is one of the emerging themes in our data which I can see. And then lots of talk about their mental health related problems are not acknowledged, or in some industry there is no policy for addressing these kind of issues. Even in some industries there are some established EAP program for employee assistance programs, but they are not very effective or not very accessible. So those are some of the findings, but those are all the risk factors. But if we take a strength based approach and talk about the positive things, so one of the findings which I remember, like what participants were sharing, is that their support system is their colleagues. Like they get along very well with each other, and that's kind of serve as their coping mechanism against stress. So this is a qualitative research. It's a bit different than the surveys or statistics or the numbers. Here the task is to understand the in-depth perspective about any phenomena. So here my focus is to understand the lived experiences of people who are working in these 5 male-dominated industries. So how we do this? This is done through semi-structured interviews. Like I scheduled one-to-one interview, and interview can be in person as well as virtual. So it's like 40 minutes to 1 hour long interview on an average. So in which we ask questions. Those are there are no right and wrong answers. It's not like a multiple choice question. So they give their detailed feedback. Basically these are like open-ended questions which we to touch upon that. This is very important area because mental health in male dominated industry is often overlooked, yet the workers in male dominated industries are facing disproportionately higher rates of mental health problems, or they are vulnerable to developing mental health problems. That comes from the literature if you look, but still there's not much studies which are looking into this. So in order to understand their perspective, like what's going on in their lives when they're at work in these industries, and because of the fact that especially these male dominated industries in northwestern Ontario, they are so isolated, they are in such a geographic location which is isolated from urban centers, and some of these workers are living in the condition where they are away from their families. So it comes with its own unique challenges. So that's why it's very timely to look into this, and the findings will definitely help in informing the policies for mental health interventions at work.